good morning. I'm Dr. Goldman and this is Dr. Lentini.
Hello.
And this video introduction for ketamine, mechanism of action, how we use ketamine in clinical setting, and a short brief demonstration of the setting in our office for your upcoming ketamine infusion. I'm board certified in emergency medicine and addiction medicine. We have started our ketamine clinic in 2017 for both ketamine and ketamine-assisted psychotherapy, and I will touch base on the different a little bit later. Dr. Lentini.
Hello. I have a background in child and adolescent psychiatry and have been working with the Goldmans for about a year in the ketamine clinic.
So what we're going to talk here today, we're going to talk about ketamine in detail. I'm going to try not to be too technical and go into neurophysiology, neuroanatomy, but I will touch base a little bit about the proposed or theorized mechanism of action. The original purpose of ketamine was human general anesthesia. It was synthesized in 1962, and actually ketamine is a derivative of PCP. PCP was the original compound, but as you can imagine, PCP caused a lot of psychosis, so they went back to the drawing board and came back with ketamine. And we have used ketamine since 1962. It's got FDA approved in 1970, and we have been using it for about 60 years for general anesthesia. And the first take-home point that I want you to take is that we cannot take the data from the literature of anesthesia and apply that to mental health because we're using it different. How many surgery do people have in their lifetime? 1, 2, 5, 10. We cannot apply how we use ketamine today for the treatment of mental health, such as depression and anxiety or chronic pain, for example. Why is ketamine so great for general anesthesia? Well, ketamine, first of all, has a really short half-life. The half-life is 12 to 20 minutes, and it does not suppress your breathing. It does not decrease your blood pressure. If anything, it will increase, and it does not suppress your heart rate. So from a cardiopulmonary and vascular point of view, ketamine is really safe. And we have been using, as I mentioned, that both in the emergency department, which is my background, as well as general anesthesia for procedural sedation. Someone come in with shoulder dislocation that need to be placed, or a wrist or an ankle fracture that need reduction, or a little kid with laceration to the face that need a little bit of sedation. What do we know about ketamine? We know that ketamine is an NMDA antagonist. It's blocking an NMDA receptor. And just to put it in a little kind of more perceptual understanding, when a molecule binds a receptor, the molecule binds a receptor and the receptor sends a signal, and the molecule can block a receptor, and you will have an absent signal or a signal of its own from that. So ketamine is blocking an NMDA receptor. It's a glutaminergic receptor. That has a downstream effect. So it's not just directly from the interaction with the NMDA receptor, it has a downstream effect that happened here that will happen for depression and anxiety. So I'm going to bring a quick illustration and talk a little bit about how ketamine works. And so we're going to use example of an SSRI. A lot of our patients are on SSRI, and example are Zoloft or Prozac or Trintellix, but we're going to just to conceptualize a little bit what is neurotransmitter, what are receptor modulation, and what is neuroplasticity. So here is a neuron that emit and secretes serotonin. So you have the neuron that send the neurotransmitter, which those little dot that you see here, and this is the neuron that accept the signal with serotonin receptor. So what you see in here is serotonin collected into a small vesicle, the vesicle going to the synapse wall, and then serotonin is being secreted into the synapse, which is the space between two different neurons. Those serotonin molecules bind into the serotonin receptor, And when they bind into the serotonin receptor, they activate the serotonin receptor and send a signal. So this is how, for example, serotonin works in our brain. Now, the way that SSRI work is that the extra serotonin that is floating here in the synapse is then taken back and is going back into the neuron that secretes them and being recycled, essentially. And when we block this receptor, so this is serotonin selective reuptake inhibitor, so we're inhibiting this serotonin reuptake transporter, the serotonin cannot go back and be recycled. So now we have extra serotonin that is floating in the synapse. What happens is that those receptors are being activated over and over again, and we amplify the signal from that. Why do people sometimes get a flat response to the SSRI? Is that after a while the brain strives to reach homeostasis, and so the brain can downregulate or eliminate some of those serotonin receptors. As the brain starts seeing all this serotonin stimulation, the brain can downregulate or cut down some of those serotonin receptors, and so the response is not what it used to be. So here you can see how we can manipulate the neurotransmitter, which are those little molecules that send the signal, the communication between two different neurons. We can change a little bit the receptor itself, so receptor can get upregulate or downregulate. And finally, neuroplasticity, and a lot of people think about neuroplasticity as new neuronal growth. Our central nervous system don't really grow or regenerate. What happens is that neuroplasticity, obviously in the brain we have billions of neurons, and those neurons are in proximity, and what ketamine seems to be doing is increase communication a little bit between different neurons. So all of a sudden those two can talk, and maybe those two will talk, and this will talk. So we will see some increased interaction between different neurons. So that's what is neuroplasticity. Not to add too much complexity, but it's important to mention that different NMDA receptor in the brain has different activity in different part of the brain. So even though we're still talking about ketamine interacting and blocking the NMDA receptor, which is a glutaminergic receptor, different NMDA receptor, for example, an NMDA receptor in the prefrontal cortex compared to an NMDA receptor in the limbic system, they will have different function. And so there's a lot of research that has been done, and we're still learning a lot about how does ketamine work. Now let's take this neuroanatomy, neurophysiology, and let's just translate that to how we use it in clinical practice. So the way we use ketamine is we are starting usually with an induction series. Now, before I go into that, I just want to first talk a little bit about the two different approach that you see that is being out there in the media. Using ketamine as a psychedelic and using ketamine for its pharmacological effect for depression and anxiety. So ketamine in a high dose, as we discussed early, it's a dissociative anesthetic. And in a low dose, ketamine has a mild psychedelic effect. Some people will name it psycholytic or a mild psychedelic effect. I'm going to, this one, yeah, thank you. So I'm going to bring this into the picture. So this is a Venn diagram. It's got a lot of information in there, and I'm going to just keep it brief. Ketamine is right here. And ketamine, what I want you to observe is that ketamine is under the category of what we call dissociative. So in a high dose, as we spoke, ketamine is a dissociative anesthetic, and it's under the circle of dissociative. But as you notice, ketamine is also in that circle over here of psychedelic. So in a low dose, ketamine has a little bit of a psychedelic effect. And the take-home point from this complex diagram is that ketamine could have a dissociative effect in some dose, a psychedelic effect in some dose, and obviously different people have different effect. So Ketamine, as we mentioned, in a high dose, dissociative anesthetic, in a low dose is a mild psychedelic. And it is the direct interaction with the NMDA receptor that will give this either dissociative or mild psychedelic or psycholytic effect. And has a downstream pharmacological effect that happen here that bring this antidepressant, anti-anxiolytic, and potentially also alleviation of pain. So how do we use that in clinical practice? For the depression aspect, using ketamine for its pharmacological effect as an antidepressant and anti-anxiolytic, we start with an induction series. An induction series is a series of 6 infusions that for the patient who have not had any ketamine before will eventually cause an interaction with the NMDA receptor, and as a downstream will cause what we spoke earlier as far as receptor modulation, neurotransmitter change, and neuroplasticity. So after infusion, if this is just for example, for simplicity, this is your depressed and anxious receptor, and this is your calm and happy receptor. After infusion 1 and 2 and 3 and 4 and 5 and 6, we are hoping to achieve a different ratio of receptor, a different degree of neurotransmitter, and different connection with respect to neurotransmitter that brings this downstream effect as an antidepressant. Now, does everyone get this effect? The answer is no. Though 100% of people will have this mild psychedelic effect during the time that they're receiving the ketamine infusion. So when they're sitting here on this recliner, and we will demonstrate later, they will have this mild psychedelic effect. About 70% of people will benefit from ketamine as an antidepressant and anti-anxiolytic. The media like to quote 70%. I will go a step further that says that this is probably true, but half of those people will respond but will not maintain, while the other half, the other 35%, will respond and maintain. And what do I mean by that? So sometimes my patient will report that after infusion 1 and 2 and 3 and 4 and 5 and 6, their depression is down, their anxiety is down, and they're feeling much better and calm. But a week or two later, they will revert back to where they were. And for those patients, the use of ketamine needs further discussion. The third that do respond and maintain will maintain those benefits for weeks and months, and will be able to utilize ketamine for their depression and anxiety and move from the induction series, that series of 6 infusions that we start with initially, and they will move into what we call maintenance treatment. And the interval between the maintenance infusion is very individual. Each patient will have their own maintenance interval. Some patient will come back to the clinic every 4 to 6 weeks, every 6 to 8 weeks, every 8 to 10, every 12, once a quarter, twice a year, and that's very individual. Let's talk a little bit about the mild psychedelic part. So although we're using ketamine for its downstream effect that happen here as an antidepressant and anti-anxiolytic, we cannot ignore the fact that ketamine is a mild psychedelic. And during the infusion, the patient do get a mild trip. They get a mild altered level of consciousness. And that element of a mild psychedelic experience is very important, and we cannot ignore that. And so it is very important, and we emphasize that in our clinic, to do the treatment in the right setting. But that experiential, that psychedelic element will allow the patient to have different perspectives sometimes and different narrative of their life. And we can also incorporate psychotherapy. And this is something unique to our clinic that we have developed back in 2019, led by Dr. Signe Goldman, that is ketamine-assisted psychotherapy. And what essentially ketamine is used as a psychedelic. So now you can start seeing how you have 2 tracks. Track number 1 is using ketamine for its psychedelic effect and combining that with ketamine-assisted psychotherapy. Track 2 is using ketamine for its pharmacological downstream effect and using it for depression and anxiety and chronic pain. And obviously, track 3, so to speak, is the combination that we have some of our patients that said, Dr. Goldman, if I'm coming and setting up a 6 infusion for my induction, or if I'm coming for maintenance, can I combine those infusion with psychotherapy? And so some of those can integrate, and they're not mutually exclusive. I have patients that come for our ketamine-assisted psychotherapy and discover that they respond really well pharmacologically as well with respect to pain, depression, or anxiety, and they're moving into doing an induction series and getting into a maintenance regimen. And some of my patients come in for the depression protocol, so to speak, which is more guided and more structured approach with the induction series of 6 infusion followed by maintenance. So they start with the depression protocol, and then they're wanting to combine that with ketamine-assisted psychotherapy and move into our CAP program. And obviously, because ketamine is a mild psychedelic, even the 30% who do not have the pharmacological benefit from ketamine for depression and anxiety, they still can use ketamine as a psychedelic for ketamine-assisted psychotherapy. And so that's the beauty, is that we have the ability to use the medication in more than one modality. Let's talk a little bit about side effect. The immediate side effect of ketamine, obviously altered level of consciousness. I wouldn't even call it side effect. That is the effect of ketamine in a low dose. And we're using that. Patient will feel this altered level of consciousness, feeling a little bit woozy. Long-term side effect, we don't have a lot reported, and we haven't been using ketamine in a clinical practice for that long. We don't have a lot of randomized prospective trial for 20, 30, 40 years like we have with SSRI, but we do not see any significant effect. And in the past 5 years in our clinic, we do not encounter any adverse effect. And another common question that people ask me is about medication interaction. There are some medication that either block the effect of ketamine on the NMDA receptor or attenuate or diminish the effect of ketamine. And we will discuss that in your personal intake appointment. I highly recommend for patients who are interested to learn more about ketamine, I recommend this book, Ketamine Infusion, A Patient Guide, 2nd edition by Berkeley Jones. I do not have any financial disclosure, and we do not get any distribution from this book. I don't even agree with everything in this book, but this book was written by a patient husband for other patient, and it's relatively large font, it's got diagram, and it's a quick book. It's available on Amazon for $12. And it's worthwhile reading as you start contemplating about ketamine. Lastly, a common question that people ask me is about ketamine interaction with the bladder. This information comes mostly from the addiction literature of patients that misuse or abuse ketamine in a much higher dose. In our clinic, we use sub-dissociative dose for ketamine treatment. That has been documented in the past decade as very safe, and as I mentioned earlier, we do not see any adverse side effect, but we do screen and always ask patients if they have any symptoms that we need to address. The last part of the discussion is about route of administration. In our clinic, we offer multiple route of administration. The majority of our patients are seeking IV, which is an intravenous, or an IM, intramuscular injection. Those are the most common that is being used for ketamine for its pharmacological effect, for its antidepressant or anti-anxiolytic. For our ketamine-assisted psychotherapy, we offer, in addition to the IV and IM, we offer intranasal spray and sublingual troche. We customize the not just the dose, but the delivery or the route of administration based on the patient clinical, psychological, and physiological needs. They come in different strengths and in different concentration, and we do use the generic ketamine when it's coming to the intranasal spray and not the Spravato. So lastly, I would like to demonstrate so you will have an idea of what to expect. In our clinic, the patient will be in the recliner. I'm going to demonstrate on Dr. Lentini, our colleague, so we can have you get a little bit of an idea of what to expect during ketamine. We start with taking vital signs, so we will take your blood pressure, your pulse, your heart rate, oxygenation, your temperature, and after obtaining your vital sign and making sure that everything medically is safe, we will continue with IV placement. Some patient might choose an IM route or an IV route, IV being the most common, but you have the option. For IV placement, me or Dr. Lentini or one of our team will be placing your IV. IV placement is something that is done routinely, and we use a very small needle for IV administration. After the IV is placed, we are connecting a small extension to the IV. The IV is being flashed with normal saline, and the ketamine itself is also being administered through normal saline. The IV is being secured with a small tegaderm, and there is no needle in the patient arm. The patient is able to flex and move as usual, and we're just going to secure the extension with a little tape. At this point, if you need to use the restroom before we start the infusion or the treatment, you can do so. So in an IV administration, as we mentioned, ketamine comes in a liquid vial. It comes in different concentration. The amount of milligram that the patient needs is being taken with the syringe and is being mixed in a small bag of normal saline. As a patient, you're going to be sitting here on the recliner. The recliner open up, and you will be able to lean back and make yourself as comfortable as you need. Each patient will receive a personal blanket, an eye mask, and will be listening to music through a set of headset. The light was being dim in the room, and we highly recommend that you can bring your support person with you. They can be here in the office and sit while you're getting your infusion, as you will need a driver to take you home. The total length of the infusion is about an hour, where the appointment is about 90 minutes, including about 15 minutes initially for vital sign and IV placement, and another 15 or 20 minutes to allow you to recover after the infusion before you head home.
Okay, so let's talk through some of the common questions people have about what the ketamine infusion is like.
I'm assuming that a lot of people just probably want to know what it feels like.
Folks say it's like dreaming, that if they've ever had a lucid dream, that it feels similar. They feel often very relaxed, sometimes a little bit warm. They have a sensation of floating.
Yeah, I would agree with that. Lucid dreaming is a good analogy. Sensation of flotation, out-of-body experience, what other people sometimes describe that. Some people will feel that report of kind of like numbing, as there's the dissociative property of ketamine, so there's a little bit of disconnect between the motherboard and the rest of the body, so to speak. So they don't necessarily have the normal bodily sensation being in space-like or floating on water.
What do you do if people are worried about being nervous or anxious?
We can reassure them by saying that, for one, with the IV, we can stop that. They can sit up, take the mask off, we can chat. They are not going to be so far under that they can't get up at any time. If they need to go use the restroom, we can, help escort them to the restroom. They can walk, you can talk. May have the feeling that you are not able to do some of those things, but you will be able to do any of that.
You have full control of your body and your mind. And that's essentially a big part of ketamine-assisted psychotherapy. You are able to express, you are able to talk, you are able to move. You have full control, even though you don't necessarily have the perception that you do.
So if I were a patient and I was nervous, you could turn off the IV.
Yeah, ketamine half-life is very short, as I mentioned, 12 to 20 minutes. And as soon as you turn off the IV drip, then within minutes, the effect of the medication subside.
Have you ever had anyone have so much anxiety that they didn't want to complete the treatment?
We have not had that, but we do have medicine here. We are staffed as a full urgent care, and we actually have a board-certified emergency room physician if someone would have something like a panic attack or anything that would be concerning, and probably we're the only clinic that has that.
So you have resuscitation equipment?
We have resuscitation equipment, we have
Oxygen,
we have medications here for helping with anxiety, we have
nausea medication.
nausea medicines,
Yeah, and we have if you dose the patient correctly, I can count on one hand in the last 5 years the people that need any rescue medication. Ketamine is very safe, and dosed correctly, the experience is very pleasant throughout your infusion and journey. When you come to the infusion, we will introduce you to whoever is staffing your room at the time of the infusion. Your support person will be able to be here on this sofa while you're on the recliner. You are fully aware of what's going on in the room, even though you're under the effect of ketamine as a mild psychedelic. You will be able to interact, talk, and we will make sure to support you in not just the medical aspect, but in any other need that you will have during your journey.